Hello, everyone. I'm finding that since I posted the video on my Facebook, my rant, I'm finding that people are going back and watching some of my previous videos. And I realized that I haven't done an update since my surgery, but also there are people who don't know what I've dealt with over the last couple years. So let me just apologize first of all for my hesitancy and my slow speech. It takes a great effort, to consolidate my thoughts and articulate what's going on inside of my brain. I have a condition called Arnold Chiari Malformation and Syringomyelia and Ehlers Danlos syndrome. I've had brain surgery twice. And my first one was in April of '06. My second one was in September of 19. So it really hasn't been that long. Has been difficult. Post-surgically, after September, I found my life was very difficult. My healing process was very difficult. Primarily because I really didn't have a place to lay my head. I lived, although I did go to stay with my father for a period of time, that didn't work out. And I pretty much had been living out of my truck with my suitcase in the truck from September until July of last year when I moved. I took what would fit in my truck and I moved back to Oklahoma. It is good to be back. I mean, I've got some great friends here, and but let me just back up a little bit because, as some of you may know, I was living in Florida, and in June of 19, I had a routine MRI, and they found that my syringomyelia, my syrinx, which is a bubble fluid inside of my spinal cord, had returned. It had been gone for many years, since '06 when I had my surgery. It returned, and when they went and did further MRIs, I went back to the surgeon who did my original surgery. When they did my MRIs, they found that I had what's called an arachnoid cyst in my left ventricle, which is a scar tissue cyst blockage in the left ventricle of my brain. My diagnosis code was not the Chiari, but it was Syringomyelia and Syringomyelia. They did go in and do the same surgery again, released that, and restored my spinal fluid movement from being blocked up to restoring flow. Post-surgically, my flow was good, and that's a good thing. It's a good thing. So, however, brain surgery is, although people like to think that brain surgery fixes you, and in the case of Chiari, a lot of people think, well, if you have a decompression or a brain lift or whatever you want to call it, that it's a cure, and it's not. Brain surgery is the equivalent of a traumatic brain injury. People don't think about it that way, and unfortunately, doctors and mostly our loved ones, they expect us to be like we used to be, and you can't come through a surgery of that magnitude and not be changed. I'm not the same person I was before my '06 surgery, and I'm different again. Far more emotional. I mean, there's just a variety of different things. So, sorry, short of breath. Post-surgically, so in December of 19, I was having symptoms, and my headaches had returned. We know that I had severe degenerative disc disease, which we know, and in my neck and in my thoracic specifically. They wanted to do fusions. They initially decided in December to wait and see how I did over the next few months, but I began to lose more and more dexterity in my hands, and they brought me back in for more MRIs. I wanted to do fusions on my neck and my thoracic. When I went in the hospital to Miami to have the test run in June of 2020, they found that I had spots on my lungs. The fusion got put on the side, and they wanted to referred me to a thoracic surgeon, and then I went through a PET scan. My PET scan showed that it does not appear to be cancer, but they wanted to follow up almost immediately. Unfortunately, they did call me and say it was not cancer, and I had to make an immediate trip back to Oklahoma. So everything got left in, it just got dropped. It's a difficult thing when you have medical conditions and there isn't the understanding or support of a community that can help you walk through stuff like that. So after lengthy conversations with my surgeon, who wanted to take me straight back in for the fusions, once we determined that the spots on my lung were not exactly sure what they are, they wanted to do a follow-up in 2 months. I've still not had that follow-up, and this is January. So it's really been set on the back burner. With regards to the fusion, it's a quality of life issue. It's another surgery, and surgery always begets surgery. And also, my surgeon diagnosed me with the Ehlers Danlos syndrome, which is a hypermobility. I've dealt with dislocations for a long time, but it's connective tissue disorder. And hopefully I'm going to get one of the doctors to kind of like explain it better than I can, which I thought would be really cool for y'all too. Excuse me. Ehlers-Danlos. Because of the Ehlers-Danlos, I have opted against having this surgery at this point in time, primarily because it being a connective tissue disorder, that's specifically the fusion, all right? Because of the connective tissue disorder, surgical recovery is very difficult. Fusions, there's a lot of mixed reports about them anyway, and there is a mindset, or I don't know the right word, sorry, it's just not there, that if you have a fusion, that the adjacent vertebra, where you have that lack of mobility, that the adjacent vertebra begin to deteriorate, leading to another fusion. It's like it starts this big and it goes to this big and this big and this big. And if you lack the connective tissue stability to hold it in place, then other things are going to give. I mean, honestly, it's mechanical. It's a basic mechanical issue. You have to, when you hold something together that's supposed to move, you're going to pay for it somewhere. Something's going to give. It's just the way it is. I do deal with chronic pain. It doesn't go away. It only changes by degrees. I have chosen not to use narcotics. That's my choice. I find them too risky, and I prefer to have my head screwed on relatively straight, even if I'm in pain. The things I do still deal with are the pain. In addition to the pain, are difficulty finding the right words for things. It just doesn't come. I process things very literally now, So if you say something to me, I'm going to create a visual picture, but it may not line up with what you're trying to tell me. So I have to be kind of creative. It makes for those people that know me, it does make it wildly entertaining at times. It's not uncommon for me to say coconut instead of donut. There's similarities between the two, but again, it's a visual image thing, and there's a. I have a short. I'm not just short. I have a short. So, I'm not sick. I have difficulty getting my breath at different points in time. I did have an echocardiogram this morning, and I haven't got the results of that, but I still have a lot of tachycardia, and which is not uncommon for me. But I'm also sitting twisted in this chair, which is making it more difficult. Okay, so I'm going to not have the fusion right now. I'm going to hold off on that. I will be talking. The doctors kind of right now here in Oklahoma have said that they don't really want to pursue further MRIs. I mean, I've had so many MRIs in the past year that my eyes glow. I mean, the flashlight. But I've had so many MRIs, and they're very hard on the kidneys, although my kidneys are doing okay so far. The doctor looked at my report of how many MRIs in different sections of my body that have been, imaged, and he's like, we really don't want to do any more of those right now. Let's just see how you move forward from here. Okay, so that's really kind of the gist of it. So as you hear me struggling to say things or to articulate, I mean, I'd love to be able to just speak on YouTube and go bam, 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 and be able to pop out everything. But if you've ever walked in a room and and questioned why you're there, or be thinking about something and it's gone, I deal with that on, I don't know. I can't tell you how many times a day about a multitude of different things. It's just, I can't grab hold of it. I know it's there, but I can't grab hold of it. Okay, so that's about it for today. I hope this helps. And, I'm okay. I mean, I've had the surgery because I was really good about updating immediately after the surgery and telling everybody how I was doing and about my recovery. And those aren't even on YouTube. I will try and move them over so that I can provide a little bit of more information on that. I don't even know if that made sense. I don't know. Welcome to my world. So, be encouraged if you're struggling with different types of things. It is difficult to walk every day with chronic pain. And we live in a world right now that is so full of so many different stressors. And I've been told you need to keep your stress at a minimum. However, it is really, really tough to do that in today's society with, COVIDs and lockdowns. And I put a mask on and I can't breathe, and it's not an insensitive thing. It's a fact that I cannot breathe. So I try to respect those who have their feelings, but it really is a challenge for me. Anyway, so I am moving ahead. I choose life. I choose hope. The day will come when we get to go home. But the bottom line is, and then I'll get a perfect body and I'll be able to dance on the porch and do all kinds of fun things. But the bottom line is right now that we have to persevere because our world, our country, whether we're all put together and perfect or not, our country needs us, and our families need us, and our friends need us. I was talking to a friend and I said, how would you feel if I lost hope? She's like, wait, what? No. Because you give me hope. Okay, it isn't about me, all right? But if you can look in from the outside and you go, you know what? She's still going. She's still going. And she won't quit. Regardless of the challenges. I get up every morning and I thank God for the opportunity to still be here. And my prayer is that He will give me the strength and the ability to do what He calls me to do on a daily and weekly basis. And sometimes I get up and I can't function. I can't do it. And I feel like I let people down. That's my world. But if I'm able, I will, because I choose life. And I will continue to push through. And I will hang on to life until He chooses to take me home. Hang in there. You got this. I'm telling you, you got this. I love y'all.